Thank you for reviewing this pre-op education prior to your joint replacement surgery. The mission of Essentia Health is to partner with you to provide an excellent patient experience supported by the mission of the Joint Replacement Program, which is to produce a well-educated patient who is prepared for joint replacement surgery and recovery. People who are educated about their surgery and planned recovery are less anxious, better able to manage their pain, and may have a shorter hospital stay. The objectives of this education session are to discuss getting ready for surgery, preparing both yourself and your home, discharge planning, what is the best and safest discharge plan for you, what to expect during your hospital stay, what to expect after your hospital stay and caring for yourself at home, physical and occupational therapy before, during, and after your hospital stay and surgery. This class is a supplement to the surgery guidebook that you received during your surgical consult visit with your orthopedic surgeon and his nurse. Please use this book throughout your surgical journey, before, during, and after. Bring it with you to your pre-op appointments, to the hospital, and to any post-op appointments, including physical therapy. Please refer to the guidebook during this session. Jot down notes or questions for follow-up or clarification. We want you to be in your best physical shape as you prepare for your surgery. The physical preparations you make can affect both the outcome of the surgery and your recovery time. A pre-op physical is done at your primary care clinic within 30 days of surgery. You will need to have this checkup to determine if you're healthy enough for the surgery. It will generally include a physical examination and might include heart tests, x-rays, blood, and urine testing. During the exam, you should inform the provider about any medical and surgical problems, as well as provide a list of medications you are currently taking. It's very important that you get to this appointment. If you have a conflict and are not able to attend the appointment as scheduled, contact your orthopedic surgeon's nurse. Everyone should schedule or should have had a recent dental checkup and cleaning. Dental conditions and problems should be treated prior to surgery. A dental infection would delay or cancel your surgery. Your surgeon would prefer that you don't have a routine dental cleaning or appointments for at least 6 weeks following your joint replacement. You may take your regular prescription medications up to the day of surgery. Your surgeon's nurse will provide you with a list of medications to stop prior to surgery if needed. This might include aspirin, non-steroidal anti-inflammatory, and some vitamins and herbal medications. If you are taking an anticoagulant such as Coumadin or warfarin, your surgeon's nurse or the clinic that manages your anticoagulation dosing will tell you when to stop taking the medication. The condition of your skin is extremely important to help prevent infection. This is especially true for the skin over your legs and around the planned incision area. Open sores, areas of infection, irritation, or swelling can increase the risk of problems like a surgical site infection and poor wound healing. You must let your orthopedic surgeon know if any skin changes occur between your last office visit and the day of surgery. Do not shave or remove hair from your leg or the surgical area for at least 7 days before surgery, and do not get a tattoo or a body piercing for at least 30 days before surgery. Please bathe or shower the evening before and the morning of surgery with Hibiclens that you receive from your surgeon's nurse. Use the soap from the neck down on a clean washcloth and rinse thoroughly. Do not use the soap on your eyes, face, ears, nose, mouth, or genital area. Use normal shampoo on your hair. Use normal soap on your face. Do not put lotions, creams, powders on your skin after using the Hibiclens. It is important to maintain a healthy, well-balanced diet prior to surgery. Good nutrition before and after surgery is important. Because constipation is common following surgery, you're advised to add extra fiber, such as bran, to your diet. If you have diabetes, your blood glucose needs to be in good control prior to surgery. During your pre-op physical, your provider should review your blood glucose levels and develop a plan for improvement if needed. Your provider should also review your diabetes medications. You may need to stop some of the diabetes pills before surgery. You should also have a plan for your insulin dosing the night before and the morning of surgery. If you smoke, cut down or quit. Smoking changes blood flow patterns, delays healing, and slows recovery. If you will need a nicotine replacement such as a nicotine patch, discuss that during your pre-op appointment. Other resources to help you stop smoking are listed in your guidebook. Start the pre-op exercises in the guidebook. It's never too early to start them. You should try to exercise 1 to 2 times a day, every day, before surgery. It is important to be as fit and strong as possible before undergoing a joint replacement. Strengthening the muscles in your legs and arms will help make your recovery progress faster. Recovering from joint replacement surgery takes time. You can take some steps now that will help make your recovery easier and faster. Planning ahead is a key to minimizing stress and optimizing your outcome. Some suggestions include clean your house and do your laundry. If you do the cooking, make double batches of everything for a week or 2 before your surgery. Freeze half, and then you'll have 2 weeks of ready-made meals when you get home. Or stock up on ready-made foods that you enjoy. While you're in the kitchen, and other rooms as well, place items you use regularly at arm level so you do not have to reach up or bend down. Borrow a walker and see how well you can maneuver through your home. You may need to rearrange furniture or temporarily change rooms, for example, make the living room your bedroom. Remove any throw or area rugs that could cause you to slip. Securely fasten electrical cords around the edges of the room. Set up a recovery center where you will spend most of your time. Things like the phone, television remote control, a radio, facial tissues, wastebasket, pitcher and glass, reading materials, and medications should all be within easy reach. Consider modifying your bathroom to include a shower chair, grab bars, and a raised height toilet. Shop for things that will make your life easier after surgery. Your list might include a long-handled shoehorn, a long-handled bath sponge, a grabbing tool or reacher, a footstool, a big pocket shirt or soft shoulder bag for carrying things around. Our goal is for most patients to go directly home from the hospital after joint replacement surgery. It is most important for you to consider the kind of help you will need and mobilize your family and friends to assist you with shopping, cleaning, errands, transportation, etc. Find family members or friends who are willing and able to assist you for at least the first week that you are home. Arrange for the family or friends to drive you home from the hospital. You may be most comfortable in a sedan-type car. Insurance will rarely cover help at home for bathing, dressing, cooking, or cleaning. It is best to plan ahead and get assistance. There are home care agencies that provide home health aides for this kind of help, but it would usually be an out-of-pocket or private pay expense. Home care services might be available for home physical therapy and nursing care 2 to 3 times a week. These services depend on your medical needs, your insurance coverage, and the availability of the services near your home. The services are appropriate if medically necessary and would be arranged following your surgery and during your hospital stay. If your medical condition is complex, you may need to go to a short-term rehab facility when you discharge from the hospital. The decision will be made by you together with your care team and your insurance company. It's important to understand that the insurances, including Medicare, will cover short-term rehab services only after an assessment a day or 2 following your surgery of your medical and physical needs and your progress towards reaching therapy goals. Please be aware that even if you have a rehab benefit, authorization by your insurance company is decided by the insurance company's medical director after evaluating your recovery from the surgery. If your insurance provider does not approve a paid short-term rehab stay, you can always pay privately. Keep in mind that Medicare and insurance companies do not become involved in social issues such as living alone or a lack of caregiver. These are issues you should address before your surgery. If you think you might need and qualify for short-term rehab, there are a few things you can do before surgery. Choose at least 2 facilities where you would be comfortable and that provide the rehab services you require following a joint replacement. If possible, visit each of the facilities before surgery to discuss the services that are provided. It is possible that your first choice of facility may not be available due to insurance restrictions or bed availability, and you will need to receive rehabilitation at your second or third choice. Final discharge plans are made after your surgery. If you're going to a short-term rehab facility, you will need transportation. Some facilities in the Duluth Superior area will pick you up at the hospital. Other options for transportation are a family member or friend, or hiring a transportation company. A medical transportation company would use a wheelchair or stretcher to take you to the facility. This expense is rarely covered by insurance providers and would require cash, credit card, or personal check payment on the date of service. The day before or the Friday before, if your surgery is on a Monday, a pre-procedure RN will call to tell you what time to arrive at the hospital the day of surgery. Please be ready to tell the nurse your medical, surgical, and anesthesia history, your current medical conditions, the name and dose of the medicines you take. The nurse will tell you when to stop eating and drinking, which medications to take the morning of surgery, where to park and register the day of surgery, and when to arrive at the hospital. On the day of surgery, you will be admitted to the hospital on the 3 North Outpatient Surgery Nursing Unit. You will meet with your surgeon to have your last-minute questions answered and to have your correct surgical leg verified and marked. You will meet with the anesthesia team prior to going into the operating room. An anesthesiologist will discuss the safest type of anesthesia for you based on your medical history and the type of surgery you are having. If you're having a nerve catheter or nerve block placed for post-op pain control, this will be done before you go into the operating room. While you are in the operating room, your family can wait in the 4th floor surgical waiting room. A volunteer will be able to answer questions and help your family stay informed on your progress through the surgery and recovery rooms. Your surgeon will speak with your family following the surgery. Most people are in the recovery room or PACU for 1 to 2 hours after surgery. From there, you will be assigned a bed on the orthopedic unit. This will be on the 4th floor of St. Mary's Medical Center. Expect that you will have pain after surgery. With your help, we will try to make your recovery as comfortable as possible. The staff will ask you to rate your pain on a scale from 0 to 10. 0 means that you have no pain, and 10 means that you have the worst pain you can imagine. Rating your pain helps your health care team measure how much your pain medicine is helping you. Your surgeon or anesthesiologist will decide what pain treatment would help you the most after surgery. The nursing staff will establish a mutual pain goal with you each shift so that your pain or discomfort is managed so you can eat, sleep, and move around. There are many techniques used for pain control. A regional block gives pain relief by blocking a nerve or a group of nerves. It may be a single injection or a local anesthetic given continuously through a small tube. Opioids are strong pain medicine, most often used for severe pain for a short time after surgery. They can be given either IV or orally. Examples are Dilaudid or oxycodone. Side effects of opioids can be drowsiness, nausea, constipation, and itching. NSAIDs or non-steroidal anti-inflammatory drugs reduce swelling and soreness. They relieve mild to moderate pain. They are sometimes used along with opioids. Examples are ibuprofen, naproxen, and Toradol. These drugs may reduce the need for stronger pain medicine. Your nurses will also encourage you to elevate your surgical leg and to keep ice on your incision area to reduce post-op swelling. You will be repositioned frequently to help you find a comfortable way to lay or sit. Guided meditation can also help you to relax and be less painful after your surgery. If you received a play-away guided imagery device from your surgeon's nurse, please begin using it as soon as possible. Bring it with you to the hospital. You will use it before, during, and after your surgery. If you did not receive a play-away and would like one, please contact the orthopedic clinic. There is also a guided imagery channel and a care channel available on the hospital television. Our goals for you the evening of surgery are that your pain is well controlled, you are able to eat and drink a regular diet, and that the nurses will assist you out of bed to walk and sit in a recliner chair. The nursing staff will check on you often, at least every hour, to monitor your pain level, your vital signs, and to administer your medications. Your home medications will be restarted, and you'll begin taking an anticoagulation medicine such as aspirin or Coumadin to help prevent blood clots. Please tell your nurse if you have any noise sensitivities. Sleep masks and earplugs are available if needed to help you rest better. After surgery, you might feel lightheaded from anesthesia or pain medication, and your muscles might be weakened or numb from anesthesia or surgery. It is very important that you never get out of bed, out of the recliner chair, or do any walking without the assistance of the hospital staff. An alarm will be placed on your bed and on your chair to remind you to call. Please call, don't fall. By about 7:30 a.m. on post-op day 1, you can expect to be bathed, dressed in the loose clothing you brought from home, and helped into a recliner chair in your room. You will receive pain medications throughout the day. The therapy team will come to your room and determine your therapy needs. If you're planning on going home today, you will attend a morning discharge information class and therapy session. Please invite your coach to attend. Group physical therapy will begin in the afternoon. Your coach is encouraged to be present as much as possible. The staff will walk with you again this afternoon and evening, and some patients may go home today. By 7:30 a.m. on post-op day 2, you can expect to be bathed, dressed, and helped into a recliner chair in your room. A morning discharge class and therapy session will be held. It would be helpful if your coach takes part in the therapy and attends the class. You may have a second therapy session in the afternoon. If you have stairs at home, you might practice that during the therapy. The staff will walk with you again in the afternoon and evening, and some patients will be ready to go home today. Post-op day 3 is similar to day 2 in the morning. Group therapy will be held, and you will be ready for discharge before lunch. Please arrange to have someone pick you up after morning group therapy. You are ready for discharge home when your pain is well managed. You are able to get out of bed and into the chair with minimal help, dress yourself with some help, walk household distances with minimal help using your walker or crutches, and climb stairs if necessary. Both you and your coach must have confidence that you can meet your needs. As an important part of the joint replacement process, the rehab or recovery coach is with the patient from the pre-op stage through the hospital stay and into the hospital discharge and recovery at home. You are encouraged to select a family member or friend to assist with this surgical journey. The coach will attend therapy sessions to help you complete exercises and to provide encouragement and support. Staff encourages the participation of the coaches to educate, to encourage, and to facilitate a smooth transition from home for both patient and the coach. Your surgeon has discussed possible surgical complications with you during your consult visit. During your hospital stay, we will do many things to prevent those complications. To prevent pneumonia or a fluid buildup in your lungs, you will do breathing exercises using deep breathing and coughing. Your nurse will instruct you on using an incentive spirometer in the hospital and at home to open the air sacs in your lungs. Getting out of bed the night of surgery and being active during your hospital stay will also help to prevent lung congestion or pneumonia. After any major surgery, particularly orthopedic surgery, you are at a risk for getting a blood clot in your leg. If a piece of a blood clot breaks free from your leg and travels to any other part of your body, serious complications such as a stroke, heart attack, pulmonary embolism, and even death can occur. We will do many things to prevent a blood clot from forming. You will wear anti-embolism or TED compression stockings. These are put on in the pre-op area before surgery and are to be worn for 4 to 5 weeks after. The socks should be worn during the day and can come off for showering and at night. The ankle pump exercises that you begin before surgery will continue after to keep blood flowing back up to your heart. Foot pumps will be placed on your feet. They periodically inflate, squeezing your feet to help return blood from your legs back to your heart. This will prevent blood from pooling in your legs and forming clots. Increasing your activity in the hospital and at home will also prevent clot formation. You will be started on an anticoagulation or blood thinning medication the night of surgery. Your surgeon will determine which medication is best for you based on your past medical history. Medications most commonly used are aspirin, Coumadin or warfarin, and Lovenox. Most likely your surgeon discussed this with you during your surgery consult visit. Constipation is common following surgery. Increasing the fiber and fluids in your diet will help. You will be started on a stool softener the night of surgery. This medicine will also be prescribed to be used at home. Increasing your activity will also help prevent constipation and gas. If dietary changes and the prescribed stool softeners aren't effective, you can buy over-the-counter products such as Colace or Miralax. Preventing a surgical site infection is very important following a joint replacement. Your incision will be covered with a strip of gauze and a waterproof dressing. This dressing should not be removed or changed after you leave the hospital unless it becomes saturated with drainage or blood. If that should happen, call your surgeon's office for instructions. Do not touch your incision. Do not put lotions, creams, ointments, or sprays on your incision until it is well healed. If you develop a cut or puncture wound, clean the area thoroughly. Watch carefully for redness, drainage, a fever, or other signs of infection. Tell your primary care doctor that you have had a joint replacement. Also tell your dentist. You will need antibiotics prior to any dental procedure, including a routine cleaning for the first 3 months following your surgery. Your surgeon will discuss with you if you are a higher risk for developing an infection and if you would require antibiotics for dental work beyond those first 3 months. When you go home, there are many things you need to know for your safety, recovery, and comfort. To reduce pain and swelling, take adequate pain medication to allow you to sleep well at night and to do your home exercise program twice a day. Prolonged pain and insufficient rest will slow down your recovery process. Elevate your leg to reduce swelling. To elevate your leg correctly, your knee and ankle must be above the level of your heart. Get your toes above your nose. The best position is to lie down on your back with 4 to 5 pillows lengthwise under your entire leg. Elevating your leg on a stool or recliner is not adequate to reduce swelling. Elevate your leg 3 to 4 times each day for at least 20 to 30 minutes at a time while you have swelling. Ice should also be used to help relieve pain and decrease swelling. Keep it in place for 15 to 20 minutes. Use ice when elevating your leg and throughout the day if swelling occurs. Your incision is closed with sutures, staples, or skin glue. This area may be bruised for a while and may itch, pull, or feel numb. You may experience a burning sensation, which can be relieved by using an ice pack for 5 to 10 minutes. You may have bruising on your surgical leg, which could extend from your thigh down to your toes. This is normal and will gradually fade away. Continue your twice daily home exercise program. You will gradually resume your normal activities. Don't overdo your activities. If your pain is increasing, it might be there because of a result of doing too much activity too soon. You will not begin driving until you have stopped taking any opioid pain medications. You are able to get into and out of the car easily. You have good control of your surgical leg as you move it from the accelerator to the brake. This may take 2 to 6 weeks. Discuss this with your doctor at your first post-op visit. Once you are feeling ready to begin driving, have your coach bring you to a parking lot to practice. If your coach feels safe, you might be ready. Your therapy sessions will begin the morning after surgery on post-op day 1. You will initially have an individual get-to-know-you session with a physical therapist. The physical therapy staff will instruct and guide you on your home exercise program. At least 2 weeks before your surgery, begin working on your pre-op exercises as shown in the guidebook. It is important to perform the pre-op exercises as pain allows. It will make you more familiar with the exercises and your muscles will be stronger. It will also be easier to do the exercises post-operatively. Your pre-op exercises equal your post-op exercises. The exercises can be done on a bed, sofa, or recliner, not on the floor. No fancy equipment is required. All you need is a firm surface and a rolled towel. Post-operatively, we will work on exercises in a group setting. This will provide an opportunity for the patient and coach to work together on the exercises under the supervision of therapy staff. The goal is to be independent with the exercises at discharge. Your ambulation goal for the hospital stay is to increase your walking distance each day, to move safely and independently with the walking device, and to go up and down stairs if needed for home. All patients will initially walk with a 2-wheeled walker. If you prefer to use crutches, the therapy staff will assist you in using them. All patients will use a two-wheeled walker or crutches full-time for the first 2 weeks following surgery. At your first post-operative visit, your surgeon will let you know if you're ready to progress to a cane. Preoperatively, start looking for equipment to use post-operatively. Family or friends likely have equipment to borrow, and community organizations such as VFWs, Lions Clubs, and churches may have loan closets. If you're unable to obtain the equipment preoperatively, we will assist you in obtaining it while in the hospital before you go home. If you're going to a short-term rehab facility, that facility will assist you in getting a walker or crutches when you are discharged from there. Some of you will see an occupational therapist either your first or second day after surgery. The purpose of occupational therapy is to make sure you or you and your care partner can manage daily activities including showering, toileting, and dressing. Post-operatively, you may struggle to stand from a standard height toilet. Increased toilet height and grab bars to push or pull from can make the task easier and safer. Some type of replacement surgeries require that you do have a higher toilet. This equipment is usually not covered by insurance, therefore you can get it preoperatively if able. Toilet risers are available with a variety of features. Some examples are a standard toilet riser, a standard toilet riser with a locking clamp, and a toilet riser with locking clamp and handles. An over-the-toilet commode can be rented or purchased, and insurance might cover the cost. Many of these items can be borrowed or can be purchased at medical supply stores or other retail locations. You can shower post-operatively while the incision is healing as long as the incision is covered with water-resistant dressing. A seat for the tub or shower may be necessary and beneficial. Stepping over the edge of the tub may be limited due to pain and mobility. With post-op fatigue, you may not have the tolerance to stand for the duration of time required to shower. Insurances generally do not cover a tub seat, so you could get the equipment preoperatively. It may be possible to rent some of the equipment from a medical supply store or to purchase from other local stores. These are also items that are often available to borrow. Also consider installing grab bars in the shower or tub and a handheld shower head. Adaptive equipment is available to help you perform your daily activities safely both before and after your surgery. These items are not covered by insurance. They may be purchased individually at many retailers or put together in a hip kit available only at Essentia Health medical supply stores. Adaptive equipment for dressing may include a sock aid for putting on socks, including the TED stockings, a reacher for picking items up from the floor and to help pull on pants, a dressing stick for pushing off socks and pants. In the early stages of recovery, your activity will primarily consist of things that are necessary to complete your daily activities and to perform your post-op exercises. We do not encourage walking simply for exercise at this stage of recovery. Over time, you will start to feel better and find that you're able to do more. With the guidance of your surgeon, you will gradually resume activities such as walking, biking, dancing, golfing, swimming, bowling, and gardening. Activities you should permanently avoid include high-impact running, jumping, and repetitively lifting more than 50 pounds. These activity restrictions should be discussed with your surgeon at one of your post-op visits. Each surgery is unique, with a plan of care individualized for you. We want you to be well educated and successful and to have an excellent experience before, during, and after your surgery. Thank you for your attention today. If you have questions or concerns regarding your surgery, please contact your surgeon's office. If you are a MyHealth participant, send an email, otherwise call the clinic and ask for your surgeon's nurse. You may also contact Claudia O'Connor, RN, the Joint Replacement Program Manager.